Okay, the next tab, preparing for surgery. 6 to 8 weeks before surgery. So everybody will need a pre-admission physical with their primary care provider, your family practice doctor, just to make sure you're medically cleared for surgery. This usually happens at 30 days beforehand or about 2 weeks before your surgery. We also suggest that you contact your insurance company, and this is just to address questions on knowing what your insurance will cover of the surgery, of medications, what your short-term rehab benefits are, outpatient therapy benefits. So just kind of being more familiar with your insurance. And I'll cover a few of the questions that we ask on a future page here. We are tobacco-free here. We will also ask you about your immunizations, the flu and the pneumonia ones we may ask you, just to get that on file so we know if you've had these. If you have not had them, we will offer the pneumonia shot right now. And the surgeon prefers that you refuse to get these vaccinations here. They don't want any vaccines 2 weeks before or 2 weeks after your surgery. And that's because of the side effects that these vaccines can cause. Sometimes they cause fevers, sometimes they kind of mock the symptoms of these conditions. So they don't know if you're sick from the vaccine. It could postpone your surgery, and same with while you're here after surgery. You know, getting these vaccines and then all these symptoms. So that's why they want you to wait 2 weeks before and after your surgery. Healthcare directive, if you have a healthcare directive, bring that in. If you have any updates to your healthcare directive, bring that in so we can update that. If you do not have one and you're interested in getting one, we have paperwork here to help fill that out, and the social worker also helps fill out your healthcare directive if you want that completed here. So just an option. Next page, on B2, your insurance and Medicare. So in B2, those are the questions that are good to ask your insurance, become more familiar with. And on B3, it goes through the Medicare benefits. So just kind of read through that. On B4, now we're 2 weeks before surgery. So there's a CSC nurse, or Center for Surgical Care nurse, that will contact you a couple days before your surgery. And this is a 20-minute phone call. So if you are in the middle of something, making lunch, running errands, they can call you back at a later time. Just let them know. So that 20-minute conversation, they'll review your home medications. They'll tell you when to be here for surgery, what time your surgery is at. They'll tell you when to stop eating, stop drinking. They'll tell you what meds to take the night before surgery. If there's any meds to take the day of surgery, they'll go through all that stuff with you. Begin taking your iron pills. A lot of the surgeons prescribe iron before surgery, so take that as prescribed. And start thinking about your resources at home. You know, who's going to help you at home? Who's going to bring you to surgery? Who's going to pick you up from surgery? Who's going to be available when you are at home to get to your appointments? Just thinking of your resources, families, friends ahead of time, neighbors that can help you out. And then, of course, report any signs or symptoms of colds or flus to your surgeon, especially when your surgery date's approaching, because that can postpone your surgery. We want you to be as healthy as you can be coming in for your surgery. Okay, so B5 through B7, it goes through a checklist of preparing my home. So these are things that you can prepare your home ahead of time, so when you're discharged here, your home is all set up for you when you get home. And just on the bottom of B7, other things to consider: having some comfortable clothes to wear, having a couple sweatsuits, pajamas, or clothes that are even a size bigger, because you will have some swelling in that hip or knee, and you don't want to try to get tight clothes over that. Other things to think about is pet care, paying your bills, getting your ice packs prepared. So all that stuff you can do ahead of time. Okay. B8, it kind of shows you some of the vehicles that will be picking you up for discharge. So just think about who's taking you home and what type of vehicle that they have. The main thing with this is making sure there's enough leg room in the front for your comfort. You are able to bend your new joint, pretty well, but it's just your comfort getting in and out of the vehicle. And physical therapy will review with you how to get in and out of that vehicle with your new joint. So on B9, equipment needs. So if you're a hip or a knee, everybody for either surgery will need a 2-wheeled walker. And we will provide those here while you're here to use. You can pick this up ahead of time. You can bring in your walker here and we can adjust the height for you. But we will provide them here while you're here, but you will need one when you go home. Other things to think about is how high your toilet is at home. Some people, if you have a really low toilet, you may need a raised toilet seat. And it's doable. You can get off and on, but it's a lot easier with a higher toilet seat. Other things to think about, and therapy will review this with you if you would need a sock aid, a reacher, some other things that could help you out. And they'll have a list of that, where to get that from too. And as you see on B9, there's purchasing equipment and where to borrow equipment. So on the next page, B10, a lot of our patients will borrow stuff from the Goodwill or Easter seals. And it shows their hours and days. It's Monday through Friday, 9 a.m. to 4 p.m. The thing with the Goodwill Easter seals is they don't deliver equipment. You have to go pick it up ahead of time or after. They just don't deliver. They have pretty much anything that you can think of for equipment, so your walkers, commodes, crutches, canes, elevated toilet seats, pretty much anything that you can think of. It's free. You can keep it for a couple months, and then once you're done, you can return it. And a lot of people like to go this route is because you don't need that equipment much after those months anyways, so you don't need it anymore. Okay, so B11, you're not going to eat or drink anything after midnight. If that CSC nurse told you anything different, you may have a later surgery, so they may bump that time back a little bit. But nothing to eat or drink after midnight. This includes chewing gum, sucking on any candy, because that produces more saliva. So they don't want you to do that either. All right, so information on your home medication, there is a reference. The last tab in this book is just for references. And you'll see as we go through the binder, the bold, it says see handout and reference section. So on F1, there is information on your home medications. And that sheet pretty much talks about we don't want you to bring your home medications to the hospital. We have all the meds here. If you're on something rare, we have resources to find it to bring it in for you. That's why we check your home list before you come in. Also, safety reasons, we don't know what you keep in your bottles, different bottles of meds. So safety reasons, we need to know that med is exactly what we're giving you. And also insurance usually pays for one sum of money that covers your surgery, the therapies, the medication, so you don't save yourself bringing in your own meds anyways. Other things to bring with you for surgery is an identification card or a driver's license. If you have a pacemaker card or any information on that, so we can get that on file. If you use a CPAP or a BiPAP, the breathing machine at night, you can bring that in, use your own, or we do offer it here, but I know a lot of people like to use their own. Comfortable clothes, bring those in. We will offer you a robe, some pajama pants, and a gown, so you can wear that through your stay here, but some people like to put their own clothes on the next day after surgery. Walking shoes, having a good pair of shoes with support. This doesn't mean go out and buy a new pair of tennis shoes for your surgery, otherwise then you're learning to walk with your new joint and your new pair of shoes. So shoes that are already broken. Reading material, glasses, if you have that in a case, contacts and solution. We suggest that you do not bring large amounts of money or expensive jewelry because we don't want that to get lost or misplaced. And of course, bring this binder with you because it's got all your exercises in it, and the nursing staff will go over some of the education using this binder. Okay, next page. On B12, now we're going to get you ready for surgery. So again, you're parking on the south side, entering that where the surgery area is at, checking at the desk, they'll give you an armband, and then they'll take you back to what we call the pre-op holding area. And this is where we'll get you into a gown, start an IV, start some fluids on you. We'll check your vital signs, your blood pressure, your pulse. We do not want you to shave 3 days before your surgery around that incision because we don't want any open areas where that incision is going. We'll remove any jewelry, rings, piercings. Make sure you do your scrub those couple of days beforehand and the morning of surgery. And in the pre-op holding area, we'll start with your TED socks. Sure you've all are familiar with these. There's two types. There's a thigh high and then there's a knee high. So we'll put these on you. You'll wear them the entire hospital stay. We'll take them off morning and night. Just check your skin, your heels. And then you'll continue to wear these at home for, they say, about 2 to 3 weeks. But then you can take them off at night, rinse them out in soap and water, hang them to dry, and then put them on the next morning. If you're a knee surgery, you'll only get this sock on your non-operative leg because that dressing around the knee is kind of bigger and bulkier. So the next day when we do that dressing change, then you'll get both of your socks on and you'll match. So they'll put that on you right away. They will also go over this incentive spirometer. I don't know if anybody's familiar with this. This is a breathing machine. Your lungs kind of get sticky and lazy after surgery. So we do this breathing exercises to prevent any pneumonia. And what you do with this is you exhale all your air and then you inhale. And when you inhale, it'll move that white tab up to your lung capacity and let it go all the way back down. You repeat that 7 to 10 breaths every hour while you're awake. And we'll have this at your bedside to help remind you too. Let it go all the way down and then repeat it again. Otherwise, if you don't, that's cheating because that white bar will keep going higher and higher. So this yellow tab right here, they'll do this before surgery because we want an amount before surgery what your lungs can hold beforehand. So then we want to match the white bar with the yellow bar because that was your previous lung capacity. And then let that go all the way down. So that's the incentive spirometer. You will also meet your anesthesiologist at this time. And I'll kind of go into the different types of anesthesia in a little while.